Hi, my name is Barb King. I'm a family nurse practitioner and have been one now for about 16 years. I have had the luxury of working with someone that I look up to immensely, who was a teacher of mine, was a preceptor of mine, was a mentor of mine, and continues to be so throughout all of these years. I'm speaking of Dr. Thomas Davis. I have known him since I was a student at St. Louis University, and he willingly took me under his wing to allow me to further my education, to learn the true role of a nurse practitioner, and to put that to use with amazing patient care. When I was a student with him, I got to see a little bit of everything, every type of patient, every patient need, every economic status, all of the above. I was lucky enough to actually go on home visits with him, and that was an example of his completely unique and amazing understanding of people, their needs, their wishes, and what we as nurse practitioners can do to become part of that team that takes good care of people from the top to the bottom. In doing that, I learned so much about patient care that you thought you knew, or I did as a long-term RN prior to starting my degree, but so much more than what I ever could have learned sitting in a classroom or online learning my degree or gaining my degree. Since that time, or during that time, I guess I should say, I told him that I'm going to work here someday, and that was because of his approach to the process and to me. In all of my years as a nurse, I fought to be recognized as a good member, as an important member of the team to take care of patients. And I was lucky enough to have been able to do that in an RN role. But learning to be a nurse practitioner was completely different because honestly, there just isn't that much acceptance, willingness, and true, genuine desire to include us in this role as a healthcare provider. Completely different here and completely different, thank God, for my experience. I teach at St. Louis University as well as an adjunct faculty member, and I'm lucky enough to have students also precept with me. But what I recognize in doing that now that I'm practicing is how much I didn't get in the book learning and the classroom setting, and how much I can't truly even think to thank Dr. Davis enough for in my preparation and my refining of my skills as a nurse practitioner. He is genuinely one of those doctors that stands out. He is light years ahead, in my opinion, of his understanding of what we are and what we have to offer. He wants us to learn how to be the best that we can. He wants us to be a benefit to ourselves, to our patients, and to any organization that employs us. He includes us. He teaches on a regular basis, not just patient care, because God, there always is something that happens in a day that hadn't happened before or is just a little bit different. So does he teach me? Yes, every day about the actual patient care. But he also teaches me about being the professional that we really are as nurse practitioners. He recognizes what we bring to the table, and he does everything humanly possible to teach us how to present that and to make that known to everybody around us. I can't even begin to tell you the volumes that I've learned in that prospect. One of which, one topic in particular, is that how to identify the risks, benefits, the insurance approach. How do we take good care of patients and be financially solvent with this process as well? What can we do to, number one, take the best care possible of patients, and number two, meet the needs of the financial situations behind us? Because let's face it, most of us at least are doing this not just because we love to take care of people, but also because of the financial help that it provides us. So over the last 16 years, Dr. Davis has, again, in his very unique fashion, taught me risk benefits, taught me about coding, taught me about insurance expectations, but all of which was done under the heading of how do you take the best care possible of our patients. And he has made it very clear to me and to everyone around us that I am an equal partner. I play that part with him. He takes responsibility like he should as the physician, and he does not work away from that. But he recognizes that we bring a whole nother piece that perhaps the doctors can't. Coming at it from a nursing perspective, as I would assume you all understand, is completely different than coming at it from the medical plan. And so I think he recognizes that and brings our benefits, our good things to the table, but then teaches us how to do it well and to become financially responsible to ourselves as well. That's one thing that I guarantee you we did not discuss in my degree. As I got it, there was no negotiation skills. There was no recognition of your talent and what that means to the organization that you may be interviewing with or going to work with. That just wasn't there. And perhaps that's because there wasn't time, or perhaps that's because nobody's real comfortable in how to approach that. I'm not certain of that answer, but I can tell you that in the 16 years of practice, I have become so much more acutely aware of that value that I have, and I'm willing to talk that value. In the past, it would have been, yes, sir, thank you, whatever you say, that'll be great, no matter what that was that they offered. And now it's like, well, wait a minute, how about this? What about supporting our organization in education? What about recognizing the additions that we can make into the practice? And the reality is that we are going to be what they need. So learning that from an expert and a kind soul like Dr. Davis has been invaluable for me, and certainly has helped me to form into the nurse practitioner that I am today.